Guys, I decided since today is my last day of clinicals that I would make a video about my clinical experiences this semester. So I thought I would start with talking about my clinical notebook because it has been with me pretty much every week since the beginning of the program. Here it is. It's nice and green. It comes with lots of interesting things like this is my nursing diagnosis little cheat sheet. It has all of the NANDA nursing diagnoses for adult health. And basically, during clinicals, we can whip this out and say, oh, what was that nursing diagnosis? This would be perfect for my patient. Oh, there it is. You know, it's on the back of the card or whatever. So that's been really handy. I dropped this over here. This is my physical assessment little cheat sheet, and it sort of gives the high points that we need to hit, just in case we forget something. We can look at this before we go in to do our physical assessment and make sure that we're going to hit all the highlights. Then the back of that is sort of information about adventitious breath sounds, normal lung sounds, the PQRST pain assessment, and also the 5 P's of circulatory checks. So those have come in handy quite a few times. We also have our clinical tools in here, and those are basically sheets with patient information, not identifying patient information, but patient information such as their background data, health history sort of things. Just trying to fish through here to find something interesting. This was for my patient with pulmonary embolism. See if I can get it out of here. Surely that is not that long. I guess it is. Okay. Well, basically on the first page, we have questions like indicate why your client has been hospitalized. You need to ask your patient to describe their symptoms. Why did they think they needed to go to the doctor or go to the hospital? How long have they had those symptoms? Was there anything they tried at home? Did it help? And then we're supposed to ask sort of what their condition means to them, what the client's diagnosis or whatever means to them. Just to sort of get, I guess, the client's feelings and any anxieties they have just sort of out in the open. And then we start researching the client's diagnosis. So the next 2 pages are all just research materials about what the client's diagnosis means, what complications there are, what are the risk factors for getting this particular disease or injury, and then what sort of labs they might order, what the abnormal labs would be for this particular condition, treatments for that condition, and then we have a long list of interventions that we anticipate for that particular shift. So with my patient with pulmonary embolism, you know, I would monitor their oxygen saturation and their respiratory rate and depth, and I would listen to lung sounds. I would, you know, check their circulation, check their mental status, that kind of thing, as well as things that I would do for every patient, like assess their fall risk, assess their Braden score, just all that sort of stuff, you know, risk for DVTs. I need to make sure all of that stuff is in there for every patient. And then I would have other interventions that are specific to just my patient and their condition. And also, we do like sort of health background, so like what physical activities they engage in, what types of food they enjoy eating, how often they typically eat, and if they have any routine physical exams, if they do self-checks, so like self-breast exams, self-testicular exams, and also skin checks. So to make sure there's no skin breakdown or decubitus ulcers, or, you know, if the patient's, say, diabetic, making sure their feet especially are well taken care of, that there's no skin breakdown there. Also, we're supposed to ask questions about their occupation, especially if that has anything to do with their condition, if their occupation puts them at any particular risk for a particular condition. And then things like marital status, how many children they have, what their support system is in the community, and also any spiritual practices that give them comfort. Because remember, we're dealing with the 5 interacting variables. So we're dealing with the physiological part, but also we're dealing with the psychological, the sociocultural, the the spiritual, and basically just the whole client, their emotions and everything. So we need to be really careful about what kind of things we're focusing on. We don't want to ignore part of the patient's situation by just focusing on their physical problems. So we also get their past medical history and surgical history, as well as allergies and their family history. So, if their parents had heart disease, if there was cancer in the family, if someone had diabetes, kidney disease, or strokes, those things are important to know. And then later on in here we have vital signs, and any abnormal vital signs we find, we have to list why they were abnormal, like what we think caused that abnormality, and what we can do as nursing students and as a nurse to fix it, or at least to treat it. So basically that's what this is. These are my vital signs for my 2 different vital sign checks on the shift. And then this person had a lot of abnormal vital signs, so I have quite a bit written about what was abnormal, why it was abnormal, and what I would do in that situation. And then we assess for fall risk, braiding score, and DVT, and what measures are taken to prevent blood clots and falls and all that sort of stuff. Then we do DAR notes, and that's basically data that you've gathered about a particular situation, actions you've taken to fix that problem, and the client's response to your actions. So my client's respiratory rate was high. So the data would be what their respiratory rate was, maybe what their O2 saturation was, also any discoloration or altered mental status, which he didn't have. But and then my actions might have been to raise the head of the bed, encourage him to deep breathe or cough, use this incentive spirometer. I don't know. Well, obviously I would let the nurse know and my instructor know, but just sort of things like that. Those would be the actions, and then the response is whether his respiratory rate increased, decreased. You'd hope it would decrease. If it decreased, what did it decrease to? If it didn't change, didn't help, maybe you need to do other interventions. So that's the kind of stuff that we're doing. And then we also do physical assessments, and I have my physical assessment flow chart in here that we practice with. That's this. And basically it's 2-sided, and you do a column per shift. Since we're only doing 6 hours this first semester, we're just using the other columns for other patients. But basically it has everything that you do in a physical assessment, and you just check boxes for things that apply, and you initial in every box to show that you actually read it. And if anything that you left blank was because it didn't apply, not because you hadn't read it. And then the last thing we typically do with our tool is lab values. So I have all my patients' lab values from admission and then current ones. I say if there were any abnormal vital signs, what could cause that, or not vital signs, excuse me, any abnormal lab results, what could cause that, and if they've changed